Our next panel will be Dr. Jeff Smith, Rebecca Allen, John Bickle, and Jeremy Newman. Come to the front, please. Jeff Smith, Rebecca Allen, John Bickle, Jeremy Newman. Are any of the four of those individuals here? Jeff Smith, Rebecca Allen, John Bickle, or Jeremy Newman?
Looks like they're trying to get it.
Okay. Well, we'll mark them as not present. Some of them submitted written testimony. Trista Miller, Pastor Joseph Head, Erica Lee Carter, Timothy Belsett,
Oh, I know he's here. He was just right outside talking to someone.
well, it's okay. We've got four. I'll call Timothy next. That's fine. Trista Miller?
Yes, sir.
Okay. Please state your name when you begin your testimony.
My name is Trista Miller, and I'm here in several capacities today. I'd like to start off by saying thank you for the opportunity to address you guys and present my written testimony. The group that I am here to represent is Brave, along with Tyrone Obaseki, which you guys heard from earlier, and some other members of our group. My partner, Tyrone, and I, who founded Brave, are a pair of highly intelligent, educated, informed child welfare professionals who also happen to be former foster youth. Our years of educational, professional, and personal experiences are invaluable to the agency and the work they do with children. Even the state of Texas thought so when they employed both of us, even though we both left when we found out that CPS isn't really the place to change foster care or outcomes for young people. It is going to take much more than just CPS or even HHSC to do all of the things that are required to help kids. It's going to take the legislature, the community, our faith-based communities, our educational system, and even the families that we work with to really make the kinds of changes that are so desperately needed for the kids in state's care. The testimonies that you heard today were very emotional from other former foster youth, but please know that we are fueled by our experiences. We are not blinded by them. The youth that we had brought with us have the kind of experiences that are the most valuable because there is no place on earth that those can be taught. They can only be lived through. Here at Brave, we understand program development, service delivery, single source continuums, predictive analytics, and even foster care redesign thanks to the college education provided by the state of Texas. However, even with our college education and combined experience of over 20 years of only professional experience, we continue to be astounded that while some limited progress has been made, the vast majority of the issues that we faced while in care and transitioning are the same issues that young people are experiencing today. If you heard the testimonies from earlier, some of those young people have recently aged out of care, while Tyrone, like myself, is almost 30 years old. They are the same experiences, only years and years apart. Our written testimonies include recommendations and solutions that we believe would make immediate improvements to the system for young people aging out, such as asking the department to work with DPS to develop a waiver program for IDs and to work with the Department of Vital Statistics for a waiver program for young people to get IDs and birth certificates, which is one of the biggest hindrances to employment, housing, and other things that young people need when they leave care. Other solutions that we have proposed are longer-term solutions that will force everybody to kind of hold themselves and each other accountable, but are the kind of solutions that we truly believe will lead to the kinds of changes, improvements to the foster care system, and improvements to outcomes for young people, my brothers and sisters coming out of care, that are so desperately needed. You guys can read my testimony. You'll know what my recommendations are. The last thing that I want to say is that in 2007, when the Sunset Commission overhauled TYC and TJPC, many of my friends had been in those systems, and we were astounded, amazed, and it was the topic of conversation for months that the state would come and actually care about us enough to say that those abuses were unacceptable, that children could not sleep in hotels, and that something had to happen immediately. You guys are the most powerful people in Texas to address these issues, and we beg you to do so today.
Thank you, Ms. Miller. Appreciate your testimony. Pastor Head.
Yes, I'm Pastor Joseph Head. I'm the pastor of the Kingdom of God Ministries. I'm a youth advocate for foster care and youth. I'm also representing foster leaders, exhibiting foster care talents and gifts. I am what they called CPS's worst nightmare. And you probably say that because everything that they expected and they thought would happen to me failed. Because my mother abandoned me. I was a project child. They abandoned me at the Dallas Life Foundation. They shifted me to D.C. I was adopted by a family in New York City. I've been put in many orphanages, emergency centers, all during my childhood. I lost 2 foster mothers tragically. I had a couple of friends and family brutally murdered. I was an ex-gang member. I was put in juvenile justice system. I was put in a last resort foster home where they thought I was dropped off, and they thought, well, you might as well forget about Joseph because he's going to fail, he's going to die. And today, I do honor you guys, and you're sitting looking at a guy, a witness that I am a school teacher and a coach in Arlington ISD. I am a counselor for inner city youth gangs. I minister the gospel of Jesus Christ to kids everywhere in youth and inspiring them and giving them hope that there is hope beyond their life and their childhood. And today, you understand that the culture of foster care is increasingly and is growing. And my plea and my cry today is that there's so many kids that are running away from these homes, that they're being placed in by CPS. And my cry, my plea is that we need to do better investigations and home studies of these homes and these parents. And some of these kids are being provoked to leave because the parents understand that if I can get rid of this child, I can replace them with another kid that can give me income. And so there needs to be a combination and collaboration of work with the police department to find out the reports on what's happening in these homes with these kids, because they're running away to something. Drug dealers, sex traffickers, pimps, and all of these things we're discovering, and the rate of these things are increasing. And I'm pleading, I am the voice for these youth. I am their tears. I am that youth that when I transition, some of the youth are scared and they're confused because they're running back to lives that they're familiar with, and they're running back into self-destructive lives. And I'm here to plead their case, and I'm here to ask y'all to please make recommendations, whatever you can do, to deliver them from their oppressor, deliver them from the hands of people that are afflicting them.
Thank you, Pastor.
Please.
We appreciate your testimony.
Thank you.
Trading Gavels back. Trading Gavels back. I have business to take care of there. Thank you. Thank you. And you were Pastor. There you are, Head.
Yes, ma'am.
Thank you for being here. And I'm going to go back and call these individuals one more time because I understand that they did not acknowledge being here. Was Ms. King here? Okay, Dr. Jeff Smith.
I'm here.
Okay. Is Rebecca Allen here? Okay. John Bickle?
Here.
Okay. Jeremy Newman. Mr. Newman. Okay. All right. Dr. Smith, go ahead.
Thank you and good afternoon. My name is Dr. Jeff Smith, and I'm the Director of Operations for Therapeutic Family Life, a child placing agency and adoption agency serving about 650 kids statewide. Our agency served about 14,000 kids over the past 21 years, and our agency focuses on foster children with high-risk behaviors and some special programs specifically designed for sex offenders to treat them. Every child placing agency has specific resources, a pool of foster parents and staff that work with particular populations of children, and each agency offers all types of resources to their foster parents to provide the best for the children they serve. We provide training, 24-hour support for crisis intervention. We offer respite services to prevent foster parent burnout. We provide clothing to youth, and as they enter the foster care system with little or nothing. Each agency visits their foster children in care every month, many times, several times a month. We and our families ensure that children are safe in care, get to visit their siblings and other family members. We write extensive treatment plans, monitor and document every behavior, medication, educational performance, and safety risk that the child might encounter. We know our children, and our families know our children. But the system is broken, and we know that. And this was the purpose behind foster care redesign, to improve the outcomes for our children and our youth, to actually force outcomes on a managing agency. And when those are truly the outcomes and the responsibility and the charge of the department. And with all the resources at the hands of the department, they were unable to be successful. Although the intent of redesign is to keep kids closer to home, to reduce moves, and to be cost neutral, there's evidence that proves that these outcomes are not trending positively, and others are not even possible under the current paradigm. Again, we all want a better system, but when you sequester limited resources to a single region and expect broader and better outcomes, you're doomed to a limited and narrow result. Let me speak to cost neutrality. Redesign was conceived and mandated to be cost neutral, and of course to the department it is. But when you design a system for a for-profit corporation as a managing entity, the cost of the service comes to the provider, the child placing agencies, and funds to provide services to children are actually limited now. For foster parents and staff, they have further to travel than ever before. These additional costs are being absorbed by already underfunded agencies. The bottom line here is that agencies are traveling more, reporting more, and funded less. There's less resources, less time to actually provide face-to-face services to children, and that impacts the safety and providing any normalization for the best environment for these kids. The role of the department is to care for these kids. I would urge you to look at the data presented by the department and consider the crippling effect to the children and the foster parent community. Thank you.
And you're here in Austin?
Yes, ma'am.
Let's see. Okay, was Rebecca Allen here? Rebecca Allen? Okay. Stay there. John Bickle.
Right.
Good. Go ahead.
I'm John Bickle. I am in here from Texas Children's Hospital, where I'm a community outreach coordinator, and with the child abuse pediatrics team for that hospital. I'm here because of a child I worked with a few years ago when I was a clinical social worker, which is what I'm trained as. A child who died the day before he would have turned 2, and he didn't die from cancer. He didn't die from heart disease or anything like that. He died because he was abused. He died brain death. And at that point, after working with hundreds and hundreds of these kids over my career, that was the point where I said, I've got to do something to start to work with these kids to keep them from winding up at the hospital. I want to put my department out of business, okay, the child abuse pediatrics department. I want to be out of business. I don't want to be seeing these kids anymore. What we know as a thing, and working with a team at the medical center in Texas Children's Hospital, Memorial Hermann, University of Texas, Baylor College of Medicine, working together now. We're trying to form a coalition to start to address these issues, for prevention issues in our community, and we're really hoping that the Department of Family and Protective Services, which was brought up in the Sunset Report, is going to be able to work with us on this. We really want to work with them on this. Nationally, every year, we spend about $124 billion for caring for people who have been abused at some point during their life, which is an incredible amount of money that we can be using on lots of other things. Child abuse when it happens in a family is something that happens from, it's a conscious decision or a decision by a parent to do something or not to do something for that child. What we want to work with, and the other thing that we've known and that I've seen over time and time again, and the research shows this, is that any of us can abuse a child, which is what is the scary part about it. There aren't just specific people or certain people who are bad people who do this. It's good people that do this. Good people make mistakes, and they harm children. What we want to do is we want to make sure that the Department of Family and Protective Services is able to work with us, work with other community providers that are working to tackle this problem, to get these services out there, services like mental health for caretakers, parenting and mentoring that's actually evidence-based. Not just that they attend 4 classes and they're done, but that it shows that there's a program and they follow the program and that it has actually outcomes that are measurable. Education on child development. Parents expecting 13-month-olds to be potty trained, and the frustration that results of that is something that we see that's a big cause of child maltreatment. Substance abuse, intimate partner violence. All these issues are issues that we can tackle, that we can handle, and that we can do in Texas. We're Texans, so we can do this. So I really urge the legislature to continue to push the Department of Family and Protective Services for prevention efforts so that I can find a new job. Thanks.
Love your theme.
Thanks.
We have, last session I made, or was that session before last, coffee mugs for my entire Health and Human Services Committee staff that said prevention is the solution.
Absolutely.
So, thank you to this panel. Thank you very much. And now, Rebecca Allen, Jeremy Newman, Erica Carter, Timothy Belseth, and they will be followed by Bruce Kindrick, Jim Black, Reverend T.R. Allen, and Carrie Wilcoxson. Miss Allen.
Good afternoon.
Go ahead.
And thank you for this opportunity. My name is Rebecca Allen, and I represent the Texas Association of Child Placing Agencies. Our membership is a group of providers who, within their communities, bring in resources such as families to provide foster care, funds to supplement what the state provides us, and basically teaching about foster care, child abuse and neglect, and helping educate our constituents. Before I go any further, I would like to publicly thank Amy Tripp from the Sunset Commission because she was so attentive to hearing our concerns and spent so much time talking to me, and so I just want to say
That is
publicly
very nice. Thank
that I
you.
appreciate her. Also publicly, I would like to thank Dr. Schwertner and his staff, particularly Leah Alexander and Nelson Jaron, who also listened so intently and were so well versed in the issues, and so thank you so much for your help. Our association would like to weigh in on issue number 3, which is concerning foster care redesign. This recontracting model was intended to ensure better outcomes for children, to keep kids close to home, keep siblings together, to achieve permanency quicker. At this time, there is no data to support improved outcomes on those issues. Nor are we seeing a paradigm shift in how service delivery is actually changing. We do not believe it is wise to continue this project until we can see how this model actually benefits children and maintains ongoing services that they need. Agencies provide a number of services to children in addition to the pass-through rate that we give our foster parents. And Jeff Smith pointed out some of those things a while ago, to include recreational activities, clothing vouchers for children when they first come into care, when they don't have any clothing, back-to-school clothing and supplies, camps, summer camps, Christmas parties and gifts, respite care to our foster parents, wraparound services to our families so that they can keep children in care without them breaking down and having to go into many different placements, particularly case management services where our folks are going into those homes multiple times a month. And so we want to thank you for looking at this issue.
Thank you, Miss Allen. Jeremy Newman. Jeremy Newman. Is Jeremy Newman out there? Okay. Let's see. Bear with me. Erica Carter. Go ahead.
Good afternoon. My name is Erica Lee Carter. I'm the Texas manager for the National Office of Nurse Family Partnership. I'd like to sincerely thank you, Senator Nelson, for sponsoring the legislation to expand our evidence-based home visitation model in this great state. We're here to provide comments against the recommendations 6.2 and 6.3, moving NFP and the Texas Home Visitation Program to DFPS. We want to emphasize that a nurse-family partnership is a multifaceted prevention model with 35 years of evidence, but it also focuses on strengthening families. We don't just focus on the negative things. Of course, we want to prevent child abuse and neglect, but we want to also build on the strengths of our first-time moms that we initially serve. Our three primary outcomes are improving pregnancy outcomes, and in Texas, 91% of our families that have their children are born at a healthy weight and are on term, which is really important to the long-term success of that family and child. I'm also here on behalf of our 150 nurses that are not state employees but are working through nonprofits, hospital systems, public health clinics, and federally qualified health centers, and they're working with families across the state. Our second primary goal is improving the child health and development. Our nurses do screenings. They check for mental health issues, addiction, and also the child's development. And they partner with other organizations if the child is developmentally delayed. And our third primary outcome that we work with families is economic self-sufficiency. I was at a family celebration last night in Lubbock, and they serve 8 surrounding counties as well. And they asked, how many of you in these families are still in school, going past high school, or working, contributing to the Texas economy? And nearly the entire room stood up. So we look at the holistic status of the family so that they can remain strong. Lastly, I want to emphasize that our program uses highly trained bachelor-prepared nurses. We operate in 43 states. Our model has been requested by many states as a strong preventative model. And we are under the umbrella of the Health Commission or Public Health Agency in the majority of those states. And we feel we're best suited there. We focus on the medical home, well child visits. We focus on making sure the children receive their immunizations, Texas steps. And we want to stay as closely connected to the Health and Human Services Commission, who has helped manage and operate the program with fidelity in this great state since 2008, where we spread broadly. We do collaborate with CPS. Our nurses do make reports. They try to provide that stability for the family as needed. And if a child is placed with a relative when they're within our program, we will see that grandmother or that aunt and help them with the child and in partnership. So we're not against CPS, but we really want to remain under the umbrella of HHSC. Thank you.
Thank you. Timothy, go.
Hello.
I'll get to you.
My name is Timothy Belseth. I'm here as a citizen, as an aspiring academic, and as a person who aged out of the Texas foster care system nearly 6 years ago. This testimony is on the well-being of adolescents in foster care. As you can imagine, I was very critical of CPS as a teenager in care, but upon aging out and going to college, I, like many others with a similar moral imperative, chose to take action towards improving this system for older youth in care, which is why I'm here today. I thoroughly enjoyed studying child welfare and government systems, and I'm further pursuing this topic in my current graduate studies. For all intents and purposes, the literature shows that the system works well for younger children. They usually have an easier time getting adopted, which spares them the rampant instability associated with staying in foster care for a prolonged number of years and ultimately aging out. But the data on older youth is unequivocal. Foster care is not working out in their favor. I could provide a detailed account of all the hardships youth face upon aging out or the poor prospects for their futures, but I know you've all heard it before. Besides, that only tells the time. I want to know how the watch works. The topic of well-being was precariously absent from the Sunset Commission's report on the Department of Family Protective Services, and there are not many academic publications which discuss the importance of this topic. There have been plenty of discussions regarding employee attrition, factors contributing to burnout, and the amount of work caseworkers have to do. However, I argue that a significant amount of these burdens are tangentially related to the widespread unhappiness and poor social development of of youth in foster care. What is the catalyst which causes youth to self-destruct, act out, or run away? The answer, however inconvenient it may seem, is simply despair. Youth are finding enemies where they should find friends, oppressors where they should find champions. The relationship between youth and their caregivers and caseworkers is strained. What are the consequences with the perception youth have of the system? Imagine the amount of work required to simply deal with the consequences of one troublesome youth. Aside from the stress and demoralization, caseworkers must perform additional work each time a youth gets into legal trouble, changes schools, or runs away from their foster home. We could hire more staff, we could purchase more fire extinguishers, and we can train them to quickly respond to issues that flare up, but I think it would be prudent to simply remove fuel from the equation. Regardless of who is at fault for the plight of these youth, the obligation to ameliorate the situation still remains with the agency who has taken them under their conservatorship, but it is clear that they cannot solve this problem alone. The Sunset Commission's report on DFPS did a wonderful job at providing some recommendations. Many feel that these hold the right answers. Everyone is looking for the right answers. But I wonder, are we asking the right questions? Why do youth run away? Why do they implode in the system? Why do they have such poor prospects despite having nearly all conventional methods of upward mobility? Why are they unhappy? Do they not see the clear and objective good being done to them? Foster care exists as a mechanism to improve lives. It should not resemble nor function as an emotional and developmental straitjacket. If we listen to foster youth, we hear the same thing. They want to be treated like normal children and be allowed to do normal things. They want to learn how to be independent if they reject permanency, and they feel as if the entire system is crushing them. They feel as if they have no recourse, which often leads them to running away. We need to improve well-being, or many of these recommendations will fail to achieve system change that is much needed. I recommend an external study be conducted on the well-being of foster youth in hopes of generating new, innovative solutions to change this perception.
Thank you. And you are Reverend Allen.
Yes, ma'am, I am.
Okay, you're next.
Thank you so much. I'm Reverend T.R. Allen. I'm founder of Freedom Fighters for Family. We are one of countless organizations set up to expose ongoing criminal legislative violations committed by the Department of Family and Protective Services. My family and I were severely victimized by this agency. As a result of DFPS mishandling my daughter's case, a federal lawsuit was filed on behalf of myself and my grandbabies. On August 23, 2009, I contacted DFPS seeking their assistance due to my daughter abusing drugs and having my grandbabies ages 2 and 3 at the time in an unsafe environment. 3 months later, I received a call from the DFPS investigator. She stated that in fear of losing her job, she had overlooked the case and would have to come and remove my grandchildren. I informed the investigator that my daughter had placed her children in my care and was in the process of putting herself in a drug rehab program. I told her that the children were fine, they were safe, but she ignored my comment, and she just insisted on removing the children in fear of losing her job. Immediately after I spoke to the investigator, I rushed to my daughter's job and informed her of the conversation with the investigator. My daughter and I began tirelessly trying to contact the investigator to inform her that of what we were trying to do. She would not return our call. I repeated this process all the way to the program director. When I spoke to the program director, she told me that she too would look into the matter and call me back. Neither one of these people called me back. Instead, on December 3rd, 2009, I received a call back from the supervisor, who was very frustrated, and she made it very apparent that she was upset. She told me that I would be sorry for going over her head. At this time, I was shocked and I was frantic by her threat. I pretended that I had another call, and I asked her to hold on the line while I called a friend of mine and asked her to witness the conversation between myself and this supervisor. I switched over to the supervisor. She continued venting on how outraged she was that I went over her head to the program director. I tried to explain to her that that wasn't my intent. My intent was to just try to get in touch with somebody and let them know what we were doing. Her last words to me before she hung up again, that I would be sorry for going over her head. Anyway, on December 4th, the CPS investigator burst into my home, and she violated a federal court order and removed my grandchildren from my care while they were placed into my care by my daughter. And the result, because of the result of them removing my grandchildren, ages 2 at the time, my 3-year-old grandson was placed on numerous psychotropic medications. And after that, after a costly and indescribable fight against this agency, a federal lawsuit was filed.
Reverend Allen, thank you.
Okay, thank you.
Got to call the next four panelists. Judith Madrazo, Bruce Kindrick, Jim Black, Carrie Wilcoxson. They will be followed by LaQuentin Wagner, Scott McCowan. We're going to have handwriting lessons. Carrie Huffman. I almost just said the same thing from the last time. Melanie Boyd. Okay. Judith, go ahead.
Good afternoon. Hello.
Go ahead.
Good afternoon. I'm here. My name is Judith Madrazo. I come from Bastrop County. I represent my two kids, myself, and too many people like me who was disgraced by CPS. This is my small one, Aiden DC von Henkel. He's Down syndrome now. In this photo, he got 6 years old. He could walk. He walked with a stroller. He can talk. This is time he can talk. This is my older son. In this moment, here he got 8 years old, and he's autistic. In 2010, my older son was hurt for kids, was bullying for them, and it's not just only by the kids, it's bullying by the assistant principal. Unfortunate, nobody did nothing. We called it immediately because my son has a bad bruises. We call it to CPS. CPS, in that moment, they tell us, I'm sorry, 3 times. 3 times they deny the help. They tell us, I'm sorry, we can do nothing for you guys because the school is a government entity. So they close the door for us. They took us 3 days for call these people when they got it in our doors to try to take our kids. For us was completely terrible. We don't know what we do. We try to talk with too many people. Unfortunate, CPS. I don't know if it's in everybody on all this on all Texas, but CPS in Bastrop County does not work for parents. My question is, why CPS work for the government and no work for us like a parents? My small one was restrained with no reason. He was 6 years old. We don't have any answer. We got 2 cases in federal court now. So my advice for CPS, try to give us the truth. Let us believe again in CPS, because I don't believe it in CPS. Too many people don't believe in CPS. Please help us. Help us. You are representative for us. Help us.
Thank you for your testimony.
Appreciate.
But audience participation is not permitted. It's against our rules. So just, thank you.
Appreciate.
Kendrick? Yeah. Mr. Kendrick.
I'm Kindrick.
Well, you go ahead, and then we'll take you.
Okay. Yeah, my name is Bruce Kindrick. I'm the executive director of Embrace Texas, which is a church-based nonprofit organization serving at-risk foster and adopted children and their families, as well as equipping churches across the state to reclaim the care of these kids and their communities according to the biblical mandates that we find in Scripture. I'm also the president of the Collin County Child Protective Services Board, or Child Welfare Board, the facilitator of the Region 3, which is Dallas-Fort Worth area CPS Recruitment Collaborative, and a former foster parent of more than a decade, and currently a parent of 5 adopted children, along with 4 biological children.
Oh, wow.
So, with that being said, well, I've not personally experienced the level of incompetence and, in some cases, outright criminal behavior that's been testified to today by caseworkers across the board. I have witnessed a low level of quality, training, and retention, coupled by a high level of policy, caseloads, and turnover for our caseworkers. As has been mentioned, CPS attracts people who want to care for children, along with people who maybe are a little bit more indifferent about actually caring for children, but just are seeking employment. And in both of these cases, some people are quality workers and others are not. What most often occurs, in my experience in working with CPAs and my experience working with CPS, what most often occurs is the best quality workers are recruited away from CPS by private CPAs, nonprofits, and other social justice arenas, and they gladly leave for better work environments, pay, and caseload ratios. This leaves the tenured best of the lowest level workers at the supervisor, county, regional, and state levels of management level to lead and exemplify the future of new caseworkers. So as you're hearing this, imagine following the lead of someone who you wouldn't follow, that you would watch them work and then just kind of go, gosh, this is not some place I want to stay, or somebody whose shoes I want to fill someday. For my relationships with former and existing CPS caseworkers and supervisors, the training and education provided to new staff, known as the Academy, is as ineffective in preparing new staff as the PRIDE training is for preparing new foster and adoptive families. It takes months, sometimes years, to develop a high-level caseworker, and CPS is losing those who have that potential or gain that level of work within the first year. As has also been mentioned, foster care redesign maintains dual case responsibility. So caseworker quality and retention aren't solved by passing foster care placement and foster home management on to private CPAs. In fact, it is encouraging CPS staff to seek employment elsewhere as the state swings towards privatization, which will again leave the lowest level quality workers at CPS for those who the SSCCs or private CPAs don't want to hire. Certainly there's more to say, and certainly the issues are complex. But in conclusion, my recommendations include pay by performance or bonus by performance in order to hold on to the best workers, loan repayment forgiveness programs, an update and review of the training process for new staff, and an even more intensive review of staff at the management level so that performance reviews are no longer satisfied with a grade of meets expectations, but exceeds expectations.
Thank you. Mr. Black?
Yes. My name's Jim Black. I'm the founder of Angel Eyes Over Texas. I'm here today to speak on few issues. I'd like to thank Kirk Huffman for passing on a few of our ideas that were found in new issues 20 through 24. And one of our primary concerns is number 21, the addition of a third-party ombudsman. I believe it was House Bill 2217 last session addressed that, but it never got out of committee. From what I'm hearing from APS and CPS, this is a very important issue that needs to be addressed on all levels. Right now, if a family has to deal with filing a grievance, I'm sorry, but the Office of Consumer Affairs is virtually useless, and the OIG's office is not much better. These children right here were removed in 2009. They spent 1,723 days in CPS custody. They did not have grounds to remove these children. In fact, preponderance of evidence says that 3 felonies were committed in the course of the investigation. No one has ever investigated this. Reunification was addressed in the basic self-evaluation that came out in September to this commission. It did not make it into the staff report. Reunification, according to the handbook, and Angel Eyes Over Texas, our website, we track all changes to the CPS handbook monthly. This is adjudicated facts is made available so that anybody, attorneys, caseworkers, families, have it readily available so that they can know what exactly is going on with our kids. Yesterday, Senator Hinojosa drew attention to his military background. That reminded me, I believe it's the Marine Corps that uses standard operating procedure manuals. There was a mention in the report that we need to do written procedures. SOP needs to be written and it needs to be public so that we can have this adjudicated data readily available. Thank you.
Thank you. The guy sitting next to him's got a pretty good military background too. Carrie? Oh, don't go there. Don't go there.
We're Air Force, right?
Carrie, go ahead.
Yes. Hello. Good afternoon. It's been a long day.
Oh, it's going to get a lot longer.
I know. I saw the. So I had a speech prepared, but I've been sitting here all day long. By the way, my name is Carrie Wilcoxson. I'm a former DPS night investigator.
Ooh.
I worked within a specialized unit that handled some of the most difficult and challenging cases for the department, to include child death cases. And I have spent the last 5 years involved in reform efforts, working with state officials, families, and I am now an advocate and consultant for families and attorneys that find themselves involved with CPS. So we know there's a problem. And I've been sitting here all day long, and I've been listening to stories such as yours and many, many other family, parents out here and children, and it's bringing back some stuff for me. It's bringing back some stuff. I am here to tell you that what you are hearing is correct. There is a problem. We know there's a problem. Year after year, meeting after meeting, conference after conference, we discuss and have discussions about more money, more training, new programs, special programs, new ideas. In fact, I've even handed out, each of you I think has gotten a copy of a proposal that I drafted and presented to Commissioner Specia about a year ago with 2 other individuals. And then it's going to be some really cool stuff that you're going to like, because it's going to help streamline some of those tasks for those investigators and family-based workers and get rid of some of that policy over policy. And it's going to help decrease workloads and get rid of that discrepancies between those workloads amongst the different units and the workers and boost morale. But none of that that's in there is ever going to be successful until we really, really get truthful and honest about what's at the crux of all of this, the core. And that's the culture, the mentality of the department. It does have a culture, as any large group does. Culture is related to people. It's related to their practices. And this department, though I believe in the entity, I believe in its mission, I loved my job. It was a noble job. But currently, none of what we're talking about, all these neat ideas that you've heard and all these neat ideas you're going to read about, we will meet again. We will have these discussions again until we really address what's going on behind the walls. And those are misbehaviors. We are operating under a culture of egos, favoritism, CYA, and intimidation that takes precedence over the policies and the procedures that are designed to help protect our children and our families.
Thank you.
Thank you.
You're going to have to help me here. Look, Quentin?
Yes.
Okay, go ahead.
Hey, they got it this time. Well, my name is LaQuinn Wagner. I'm a former foster youth. I'll be 26 years old September 18th. That also marks 8 years to the day that I aged out of foster care. So I guess that'll be my first topic, age out of care. I ended up in juvie, age 14, troubled kid, tons of labels. At that point, basically everyone quit caring about what was going to happen to me whatsoever. So by the time I aged out, there was kind of an expectation that I would fail very soon after. And, that's why they didn't pour any money into my education or, helping me learn how to get a job, things like that. So I was homeless the first 2 years, lost, completely lost. Then coming off of the heels of a very, very, very abusive adoption. Wow, how am I going to say this? I would say, the family that got up here and spoke about the abuse that, the boys and stuff had gone through, it really hit home for me because, I was in that situation myself in quite a number of different homes and, group homes and stuff. And not only was nothing done for me in that instance, but when I started to make, because I didn't fully make, thank God I didn't, the transition to, becoming, what you would call an abuser, there was no help there either. And there's a big issue when you don't have the preventative care for the ones who have already gone through the abuse. And then you have the new kids coming in who are subjected to, the abuse from the people who have been abused. And then the kids get punished who are doing the abusing when, it really isn't their fault that they're doing it to begin with. And it's just not, it needs to change. It really does. I think the last issue that I really want to speak about is the general lack of caring there seems to be for the youth that are in foster care, the stigma. And, got to remember before these kids are brought into care, they're just normal, regular kids that are in our society. So why shouldn't they be able to keep that, that mindset and that stigma? These are our kids as a community, and we should be treating them like they are our kids. We're a community, and we should be looking out for each other. That's about all I have to say.
Good. Thank you. Thank you to this panel. The next panel will be Scott McGowan, Carrie Huffman,